Okay, so today's speakers are Genevieve, Jomi, Jenny, and Gnarly from Niagara College. They're in the dental hygiene program, and they've got a great session for you this afternoon. So with that, I'm going to stop sharing my screen, and I will invite the speakers to share theirs.
All right. Thank you for the introduction, Jessica. Let me share my screen here in my presentation. Okay. Everyone can see that, I think?
Yep, that's good.
Perfect. So we're students from Niagara College, and we're very close to finishing our entire course and starting to treat clients, and it's fantastic to see. Now, my name's Genevieve. I've actually been a type 1 diabetic for 14 years. So in this presentation, we've taken a lot of consideration into the survey that we sent out and the information we got back, and we're going to work on the education aspect, because I personally felt that not a lot of my healthcare providers really informed me on the oral health that was associated with diabetes. Okay, so we're going to move to the next slide. So these are the contents. We're kind of going to just breeze over what is diabetes. I'm sure a lot of people were quite familiar. We're going to go over a little bit of the statistics of like oral health and diabetes, and also the Indigenous population, and that there's more of a correlation with diabetes. So it's really important. That's why we're speaking to you today. And then we're going to talk about kind of preventative measures. Not all the time, like when it comes to it, dental health can be expensive, and so can diabetes medications and every other thing that goes on in life. So if it's more about the preventative measures, and it's an easy way to do that. Okay. So what is diabetes? It's a medical condition that the body either cannot produce insulin or cannot properly use the insulin that your body already creates. So the blood sugar levels are regulated by insulin, the hormone that is created by the pancreas.
Okay. The type of diabetes. We have actually 4 types: diabetes type 1, diabetes type 2, gestational diabetes, and pre-diabetes. Diabetes type 1 is also known as juvenile diabetes or insulin-dependent diabetes. It is a chronic condition that affects pancreas producing little or not insulin. What is insulin? Insulin is a hormone that allows sugar or glucose to enter the cells to produce energy. What is the main symptom of diabetes type 1? Excessive thirst, frequent urination, weight loss, blurred vision, and fatigue. The reasons of developing this type of diabetes is post-viral infection, or sometimes is due to genetic predisposition. Diabetes type 2 is also known as adult onset diabetes or non-insulin diabetes, non-insulin dependent diabetes. It is a condition in which insulin made by the pancreas can be effectively used or enabled to produce a sufficient amount of insulin to lower blood sugar levels. What is the reason to develop diabetes type 2? Some medicines, pancreatic disease, stress, or overweight. Gestational diabetes. Gestational diabetes occurs during pregnancy. This is typically occurs in the 2nd or 3rd trimester of the pregnancy and usually goes away after baby birth. Prediabetes is a condition in which one individual experiences higher blood sugar level than normal but not elevated for developed diabetes type 2. 9 of 10 people with pre-diabetes don't know that they have it. Next slide, please.
All right.
Thank you. We have some statistics for of Aboriginal people, national people. In children aged 6-11 years, 93.9% of First Nation have at least one tooth affected by dental caries. Approximately 1 in 20 First Nation adults has lost all their natural teeth. Less than half, 46.8% of First Nation age 40 and older have visited a dental in the past year. In First Nation adults, nearly 24% had one or more untreated root cavities. Next one, please. This is a statistic from diabetes. First Nation people with diabetes increased from 6.1% in 1995 to 14.1% in 2014. The indigenous population is 3 to 5 times more at risk of developing diabetes. A study has shown that diabetes patients are 5 times more likely to need dentures when compared to no-diabetes subjects. And 71.7% age 65 and plus of First Nation people with diabetes were prescribed an anti-diabetic medication, compared to 59.9% of the other people in Ontario. So, who is affected by diabetes? Between 2016 and 2017, the proportion of males who report being diagnosed with diabetes increased from 7.6% in 2016 to 8.4% in 2017. The proportion of males remaining consistent between the 2 years.
Okay, so the oral systemic link of diabetes. So diabetes has a link with gum disease, particularly in its most severe form called periodontitis and gum disease. So when you have like swollen or bleeding gums in your mouth and a gum infection, the bacteria from the gums, they can travel through the bloodstream into different organs in your body. And this bacteria can enter the bloodstream and impact your body's ability to lower the blood sugar levels. So when you have diabetes with uncontrolled blood sugar levels or higher blood sugar levels, this increases your risk of getting gum infections. And the more severe gum disease you have, like periodontitis, it is harder to control your blood sugar levels.
When diabetes is not controlled, glucose levels in saliva increases, promoting bacterial growth and the formation of dental plaque. So this increases the risk of cavities, dental infections such as candidiasis, which is like a white patch that can form on the tongue and on the palate. It also increases the chance of bone loss. So when there is bone loss, there's going to be mobility of the tooth, and eventually that tooth can fall off. Diabetes causes lower healing process for gums. We know individuals living with diabetes may experience more severe gum disease due to the prolonged healing. Gum disease increases the risk. Gum disease increases the risk of poor blood sugar control, like Jomi said. Diabetes is related to complications like heart and kidney disease. So how diabetes affects the kidney and the heart. So diabetes affects the kidney's ability to do their usual work of removing waste products and extra fluid from the body. The kidneys are filled with little tiny blood vessels, And over time, high sugar levels in the blood can cause these blood vessels to narrow or clot. Without enough blood, the kidneys become damaged. Same thing happens with the heart. So over time, high blood sugar levels can damage blood vessels and the nerves that control the heart. So some factors that can also raise the risk of heart disease is smoking, being overweight, not getting enough physical activity, and drinking too much alcohol. Gum disease can also increase the risk of onset diabetes. Diabetes is a risk factor for periodontitis. So patients with diabetes are at 2-4 times greater risk for more severe gum disease than individuals without diabetes. Poor oral hygiene can cause inflammation of the gums, and if it's not treated, the infection spreads from the gums to the bone that supports the teeth. Loss of support causes the teeth to become loose and fall out. So the gums to the bone that support, this can negatively impact the ability to eat, chew food, resulting in malnutrition. The effects of dental treatment on diabetes. So regular dental hygiene appointments help regulate the number of bacteria in your mouth. You can get when regular brushing and when helping improve blood sugar control. So the prevention and control of periodontal disease must be considered a vital part for diabetes control. Next. So dental implications of diabetes. So cavities, like I say, diabetes increases the likelihood of experiencing cavities because of the greater supply of sugar and starches in your body. This contributes to plaque buildup, so which causes acids attack on the enamel. When there is too much plaque on the teeth, that's gonna be a lot of acidic on your mouth, which is gonna start eating the enamel, which is the hardest part of the tooth. It's gonna start eating away the enamel, and that's what causes cavities. So gum periodontal disease, someone with uncontrolled or undiagnosed diabetes is more prone to gum disease because diabetes can reduce the blood supply to the gums, causing inflammation of the supporting structures of the teeth. Gum disease is an inflammatory and degenerative structure that supports the teeth. Delaying wound healing. For people with uncontrolled diabetes, don't heal as quickly because they have poor circulation. So which makes it more difficult for the body to deliver nutrients and oxygen to the wound. Dry mouth, some medications and high blood sugar levels could cause dry mouth, and a decrease of saliva can lead to cavities, mouth ulcers, inflammation of the tongue, tooth deterioration, halitosis, which is bad breath, taste disturbances, infections. Poor circulation leads to infections as well. So like candidiasis, or also known as thrush, and tooth infection.
All right, so what we actually know is when you have a high blood sugar, you get dry mouth. I know this happens to me very frequently. This also can increase the resistance, the insulin resistance in your body, and makes it harder to bring your blood sugar down. Same with low blood sugars, you also experience dry mouth. So when you treat with juice and a sugary snack and you already have dry mouth, you don't have that saliva, and that allows that sugar to stay in your body, in your mouth a lot faster, which is going to allow the acid production, and it also allows that bacteria that likes the acidity to eat away at our teeth, and that's what causes cavities. So what is also noted is that like the quick change, because sometimes I know when I feel low, I overcorrect and I have a couple juice boxes. I just feel so hungry, and like it's just a natural response. So when your body shifts from low to high, from overtreating that low, this can have a negative impact for longer because your mouth stays dry. It goes from dry and then it goes up to high and it stays dry. Now that obviously the fluctuations depend on the medications that you're taking and everything else, but it's definitely something to consider a little bit more.
Okay, so the preventative measures include brushing, flossing, fluoride products, xylitol, regular dental visits, and diet and exercise. So it is very important to brush your teeth twice daily, once in the morning and once in the night for at least 2 minutes using the correct brushing technique. So this helps to remove the plaque from the gum lines where they stay mostly and fight gum disease and cavities. And the water in Niagara region is not fluoridated, so it is very important to brush twice daily using a fluoride-containing toothpaste. Flossing once daily removes the plaque in between the teeth where the toothbrush cannot reach, and this reduces your risk of gum bleeding and infection and improves your gum health. Fluoride products include toothpaste, mouth rinses, and varnish. So fluoride is a mineral which is capable of replenishing the lost minerals from your teeth surface. So when bacteria feeds on the sugars from your diet, it creates an acid, and this acid can attack the teeth surface, which is called the enamel. But like fluoride has the potential to reverse the initial cavities which are formed on your teeth. So it is important to have fluoride in your daily routine. And xylitol is a naturally occurring sugar-free sweetener, and it has an antibacterial action. Bacteria cannot feed on xylitol to make acids in your mouth. So hence, like using xylitol, like can reduce your risk of cavities and also stimulate your saliva flow in the mouth. So there is like more cleaning action in your mouth and like less chance of cavities. So like chewing 6 to 10 grams of xylitol gums or candies at least 4 to 5 times per day will be beneficial. And regular dental visits will help you with early detection of cavities because like they are going to do routine radiographs or x-rays and will help you with early detection of gum disease and will also give you some preventative treatments like fluoride varnish, which contains at least 5% sodium fluoride, and it is very beneficial for your teeth to reduce your risk of cavities. Balanced diet and exercise will help you to control your blood sugar levels and also improve your overall health.
All right, so we're gonna, unfortunately, like this is online, so it's a little bit harder to demonstrate toothbrushing techniques. So we're using YouTube videos to kind of demonstrate it. Now, I want to make sure that the audio is kind of working. So let's take a look. Let's see.
No.
Is that working, guys?
No.
No.
There's sound.
No?
If you stop sharing your screen for a second
Yeah.
and then click share screen again, there should be buttons at the bottom that say share sound and optimize for video clip.
Let's see here. Give me a second. A little bit of technical issues. That's all right. Okay. So I'm going to stop sharing. Okay.
So click share screen
Share screen.
and there should be
Chrome tab. We're going to. Okay. Here we go. I opened a different tab for this, just in case.
Still.
We still can't hear it.
Yeah.
Okay. Well, you know what? I'm just gonna say what's going on. How about that? We'll go with that. You can see it, right?
Yep.
So the beneficial thing is that we have our toothbrush at a 45-degree angle. We kind of want to have that facing towards the gums to stimulate it, and all your plaque kind of hides underneath your gums. Yeah. This will help clean underneath the gum line. You want to move the brush back and forth, just a couple teeth at a time. You don't want to do the full amount. And what you want to do is you want to sweep at the end of brushing and sweep it out. The same thing when you're brushing down, but you're sweeping up. So just the direction of where like your chewing surfaces are. Yeah, the 45-degree is very important. And what I didn't know before coming into this program is you want to brush the inside of your teeth as well, not just the places, not just like where you chew. And that will help promote good gum health. Okay, you know, use what you got. Let's share the screen and go back to the presentation. Okay. Just trying to figure that out. Okay. 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 I don't want this slide anymore. There you go. Okay. Share screen. Okay. So the importance of flossing. When it comes to toothbrushing, it doesn't get everything. And so it's important to try and floss every day. Now, no one's perfect, and sometimes you're busy and flossing isn't a priority. But as you can see, I have a couple pictures. So before flossing, it looks like some nice clean teeth, but floss will help get rid of that plaque that kind of sits in the middle where your toothbrush kind of can't get. All right, so the 45-degree angle when we do the toothbrush, we'll try and adapt as best as you can, but it's not going to get all of the plaque. Okay, so now we're going to go into another video, and I'm just going to explain it. So it's very common for cavities to kind of get them in the middle of your teeth, and your toothbrush doesn't normally get in there. That plaque is going to cause that bone loss. So we want to remove it as best as possible. Now, floss is like the best way, but there are alternatives. You want to kind of wrap it around your fingers and use a little bit like, yeah, what they're doing with their hands. So you want to wrap it around, but you want to get it right in there. You don't want to snap right in. And you want the floss to hug the tooth. If it catches or if it tears, there might be some type of issue. I know a lot of people have their teeth very close, but you want to slide it right under the gum line and head right up to the gum and kind of pull out as much as you can. Yeah, so when all the plaque is removed, it's talking about then it'll kind of squeak a little bit more. You kind of have that, like, you'll notice a little bit more. Now, if your gums are infected, they're going to bleed. Healthy gums do not bleed. But if you floss and you take care of your oral health, if you gingivitis, which is early gum disease, it could take 3-day oral care to improve that inflammation and have your gums stop bleeding when you're flossing. So it takes a little bit, but it can heal a lot faster. Now with diabetes, that might be 5 days. I know that it takes me a little bit longer to heal because your body's focusing on your blood sugars and stuff. Yeah, and it's saying now you know why brushing your teeth is only half the battle.
Okay, so flossing isn't for everybody, so that's why it's good to go and speak to your dental hygienist or a dentist about what are the best options for you. I want to show you some interdental aids that we can also use, because floss kind of clean in between spaces that are kind of wide. Some people have something called embrasures, so it's like open contact. So there's a big gap in between teeth. So we use something called sulca brush. I don't know if you can see it. So we use this to clean in between their teeth. Also around people who had missing teeth, this is perfectly to clean close to those areas where are missing teeth. We also have the Proxa brush, which is good for those open contacts that I was talking about. And this is an interdental pick. So something else that you can use instead of flossing. And this is a floss pick. In case you kind of, if you find it hard to grab the floss and put it around your fingers, this is a good option for you. And the floss is usually used for people that have tight contacts. So the floss can go in between, but for those who have open contacts, it's best to use a Proxa brush or a sulca brush. Yeah. Next, Genevieve. Okay, the benefits of fluoride. So fluoride is good to rebuild and remineralize weakened tooth enamel. Also slow down the loss of minerals from tooth enamel. Reverse early signs of decay and fights the bacteria that harm teeth and gums. So fluoride can actually make your teeth stronger and prevent cavities. That's it.
Okay, so I'm going to discuss about some products for those of you who have moderate risk of cavities. As we said before, so Xylitol is a great product and it is antibacterial in nature, and it is also a saliva stimulator. So it's recommended that we use at least 6 to 10 grams of Xylitol per day. And the common brands available are Purr gums and Spry Xylitol mints. So you have to chew at least 2 pieces of gum or mints, xylitol mints or gums for 4 to 5 times daily, and when your mouth feels dry. And it's also available in most of the stores like Walmart, Sobeys, and the prices range from anywhere from between $3 to $5. And fluoride toothpaste include like Crest, Colgate, Sensodyne. They contain like 0.243% fluoride. It's also beneficial to fight cavities when you're using it twice daily. And the prices range from $3 to $6. And Sensodyne Repair and Protect is also beneficial for sensitivity because it contains an ingredient called novamine. And the fluoride rinses available are Listerine. We have Coolmint, Total Care Listerine. And it's recommended to use it at least once daily. And the prices range from $7 to $8.
All right, so I'm going to talk about the products for high risk of cavities. So what will put you at a higher risk for your cavities would probably having cavities diagnosed in the last 2 or 3 years. And if you're experiencing dry mouth a lot more frequently, a lot of side effects of medications is dry mouth, so it's definitely something to be wary about. So the same thing, we're going to talk about chewing saliva. Now, we like pure gum just because that's xylitol and it doesn't give the sugar for your mouth, like for the bacteria in your mouth to create those cavities. In a pinch, Sugar-free gum is the same thing. We just want that saliva stimulated as best as possible. Now, when you have a higher risk of cavities, it's beneficial to have a toothpaste with a higher fluoride than regular toothpaste. So there are two different types. One is called ClinPro. You would have to ask a pharmacy to order it because you're normally not going to see it on the shelf. I know that when it comes to Preventative, which is another high fluoride toothpaste, that is like, that can be more so over the counter in Shoppers Drug Marts, in certain places, for sure, Walmart as well. That calcium, now for ClinPro, there's a calcium phosphate added to it. And the same with, I'm going to go back a little bit, the Sensodyne Repair. There's something called Novamin, and that's got calcium phosphate. And that's extra minerals that will help kind of harden those active cavities that you're kind of having. Now, it's really beneficial to have like a supplemental fluoride rinse. We really want to recommend a higher percentage, but I think at the end of the day, any extra fluoride will do. So we have a couple options. OptiRinse can be a little bit more on the expensive side. So I really actually recommend, this one's a higher percentage of fluoride, but the Colgate Sensitive Pro Relief, that's got the 0.2% fluoride that we really like to see. But you can use the Listerine that you've got, that's extra fluoride, it's definitely beneficial. Okay, so let's talk about dietary changes. We know with diabetes, diet is really important, helps with your blood sugar control and everything else. It also does affect the health of your teeth. So, as we know, less carbohydrates, better for blood control, and it's healthier for your teeth. Now, I love carbohydrates. So, what's beneficial in that aspect, if you do have carbohydrates or frequent snacking, is drinking water afterwards to kind of neutralize the acidic environment in your mouth and reducing the cavities and gum disease, because that food might sit in there, make it easier for those cavities. You can take vitamins to help. I was talking about the vitamins that are in that toothpaste. You can take supplemental vitamins. That might help improve the health of your teeth. You might already be taking some of these vitamins for the health of your bones and whatnot. So it's beneficial to know that you're also helping your teeth at the same time. Now, what's really helpful is a diet rich in fibers. Something crunchy with like whole grains, celery, carrots, leafy greens. I know some people don't like vegetables, so we got like nuts and dairy foods like yogurt. Cheese is really great. These can improve the health of your gums. They can reduce the cavities because they lack that sugar a little bit more where it comes to like sitting in your mouth and creating the cavities. So these are like small things. You might already be doing these things, and that's great. Just things to think about when we look at our oral health. All right, so we've just got our references. Now we're going to look at your questions and go through, and let's see it. Yeah.
Awesome, fantastic. Thank you, ladies. We do have a couple of great questions in the Q&A box here, which I will get started on. And I will just welcome anyone in the audience who had other questions to please go ahead and drop them in the chat box or drop them in the Q&A as we work through the answers to a couple of questions that are here. So the first question, as for gum disease, can it still be considered when all teeth are gone? And for many years, so gum is closed up where the teeth were. Can people who are missing all their teeth still have gum disease?
Yes. So the answer is yes. You still can develop gum disease. You can still develop periodontal disease. Gum disease is inflammation of the gums. So if you have inflammation of the gums, even if you don't have teeth, you're basically having periodontal disease. Also, if you lose teeth, if you don't have teeth for a prolonged time, let's say many years, you start losing bone. So when the bone start receding, you start like losing
Getting
weight.
smaller.
Yeah. So so when you try to put a denture or a partial denture, you're gonna notice that it's gonna be a little bit challenging because the bone is not as where it used to be. So yeah, so the answer is yeah, you can definitely get gum disease if you even don't have teeth.
Great. I wonder also, following up on that, what the type of care is that people might want to do if they are missing teeth. How do you care for your gums if you don't have teeth or in a spot where you're missing a tooth?
So if you're missing a tooth, what you can do is use the Sulca brush, the one I showed, for the teeth that are around, like close to that area. Or you can use, even if you don't have any teeth, you can use a gauze or the damp cloth to kind of wipe the gums, because some people that wear dentures usually think they don't need to brush their gums because, you know, they have fake teeth.
You don't have teeth anymore, right? Why do you need to? Yeah.
Yeah, but it's essential to clean your mouth every single day. Not only your teeth or your gums, but also your tongue, even the side of the cheeks. People usually forget about those areas, but it's important to maintain a good oral care to prevent.
Especially those dentures too. That doesn't mean just because you don't have teeth doesn't mean that bacteria isn't still there being produced, right? So that's when we were talking, like you are more at risk for things like thrust, which is a yeast infection in your mouth, and that can be very painful and red and swollen, and like we want to avoid all of these things. So the easy step of just like rinsing a little bit or cleaning your dentures afterwards, like these are preventative measures.
Great. The next question is about pregnancy and whether it is okay to get a cleaning, knowing that bacteria will be elevated in the bloodstream after scraping and cleaning at a dental visit.
So usually during pregnancy, during the second trimester, like cleaning is considered safe. We would avoid any cleaning during the first trimester of pregnancy because that's the time when the organs are developed in the kid. So I mean the fetus. So like we usually avoid anything during first trimester, but like second trimester would be safe, and it will reduce your risk of gingivitis because like during pregnancy you have a lot of hormonal changes in your body. And the estrogen and progesterone levels are really elevated. So like your gums might be bleeding more. And so it's better to get like cleaning done and like do the regular brushing and flossing and get your regular dental checkups.
Great. The other question is, and this one might vary from region to region, I think. Do they still offer fluoride swish days for elementary school kids at schools? Because this town has no fluoride in the water supply either.
Yeah,
It's definitely region to region. In the Niagara region, there's no supplemental fluoride in the water. But if you're looking in areas closer, and I honestly recommend searching into it. If you drink bottled water, that is more likely to have fluoride in it. And that's something that we even ask when we speak to patients that come into our dental clinic. If they drink tap water, we know that that's not fluoridated in the area. So, but if they drink straight bottled water, that's got an additional fluoride. So it varies, yeah, it varies in regions for sure. And it's definitely something to look into.
Yeah, I think this might be, you ladies might be too young to remember when the hygienist used to come with the tray of fluoride, and you'd get your little cup at school and you'd rinse, and everyone would do it. I think for my own daughter, we're in the Niagara region, that they don't do that anymore, but I think the hygienist does come once or twice a year to paint the fluoride on them, at least in kindergarten.
Yes.
Yeah, they did that for my son as well. Last year, they did the fluoride varnish. So they paint the fluoride on all the teeth surfaces, and it is like generally considered safe and beneficial for your teeth.
Yeah, I think all that's on hold with COVID, but you know, worth asking in your own community or at your school what they do. Okay, someone has asked about a water flosser as an option.
I highly recommend them, especially when your teeth are very tight. I use mine a lot, and that obviously, like, there's definitely like a learning curve where you'll end up with water splattered all over. But it's easily recommended. In the water flosser, if you have deeper gum pockets, so when we were talking about periodontal disease, you're more likely to have deeper areas where the plaque sits, and your toothbrush won't get fully in there. You can get like 6 millimeters, so that's quite a distance versus like your floss or anything else all the way down there with that water pick. So it's actually really beneficial for people who have dental issues, and that would help like prolong having to like get your, I'm not saying not have your dental cleanings as regularly, but it can prolong any cavities, especially in the area where your roots are exposed. It's easier to get cavities in those areas because the enamel that protects it doesn't cover those roots.
Great. This last question here, I'm not sure is the expertise of you ladies, and I also don't know the answer. So Cheryl asks, by any chance, do non-insured health benefits cover any xylitol products to treat dry mouth? I tried a quick Google search here. I'm not sure if those are covered. I'd suggest maybe speaking with your dental care provider or whoever you work with around your non-insured health benefits, if there's an advice line or anything you can call or a manual to check that out.
Yeah, no, like when it comes to insurances, it depends on like diagnosis and stuff. I don't know. I used to work in a pharmacy, so I'm familiar with some type of coverage, not completely dental, but there are some medications that they feel, okay, well, that's more of a you thing than it is us. So I think it really varies on your dental or like your insurance provider for sure, but it's always worth asking. Why not?
Okay, another person seems to have some experience. This is Biotine spray for dry mouth isn't covered, but when her grandfather was in the hospital, it was. Okay, and then another question, is it better for an individual with diabetes to use an alcohol-free mouth rinse?
Yes, it's definitely better because when rinse had alcohol in it, it can cause dry mouth. So it's going to increase the chances of you getting cavities and cause inflammation of the gum. So it's best, yeah.
Especially at nighttime.
Yeah, so it's definitely recommended to have a alcohol-free mouth rinse.
Excellent.